afternoon. It is Thursday, March the 25th, 2021. Segel, David Lahashu Juts, and welcome to today's edition of the COVID-19 Task Force Update on this, our 195th edition of Kahnawake 911. On this afternoon's program, our guests will be Jaime Samaoya, the clinical supervisor of the Assisted Living Services, MCK Chief Mike Delisle, and Commissioner of Public Safety, Lloyd Phillips. And we're going to begin our show with Jaime from Assisted Living Services, and he is joining us live via Zoom, so don't mind me as I turn to look at Jaime on my laptop over here. Hi Jaime, how you doing today?
I'm good. How are you doing, David?
I'm very good, thank you very much. So first of all, maybe you can explain to our audience, what is Assisted Living Services?
Well, Assisted Living Services is a service area of KSCS that dedicates efforts to provide services for the vulnerable populations, including people who struggle or live with severe and persistent mental illness, and or people who have a developmental delay.
Okay, and what has happened during this pandemic over at Assisted Living Services? I know it's been extremely difficult for everybody, but we're talking about people who are basically in seclusion now for most of this pandemic. And what has been the impact of COVID-19 on the services?
Well, it is, like you mentioned, it is difficult for the public in general. Is for many reasons, the level of isolation and restrictions, the lack of contact with others. And this is especially harder on people whose mental illness is already compromised. And also for people who struggle with the developmental delay. Some of them may not understand what the context of why there are restrictions. And that makes it for sure harder on them. As such, the staff who specializes in providing services for them, they have adapted their level of support to meet the increased needs of the population we serve. We serve one of the most vulnerable populations. And it has obviously been harder, but at the same time, we have seen the level of resilience that the population that we work for exhibit. They have been tremendous in terms of their ability to sustain the impact of COVID. And also want to mention the hard work and the dedicated work of all of the staff members who provide these services.
People who work with the elderly in assisted living services, elderly care homes, so on and so forth, hospitals. It's not only been very difficult on the people who are residing in these residents, but also, of course, the healthcare worker, the program workers who are there. And I was just wondering how you guys are dealing, how you guys are dealing with this pandemic right now, because you're dealing with it professionally, of course. Like most of us in this milieu, we're dealing with it professionally and personally, so we don't really have an escape right now from the pandemic. So I was just wondering, in your own words and comment, how were you guys doing in all this pandemic as well? Because there is an impact on the workers.
There has been a certain level of frustration given the reality. It's a delicate balance, because we all understand the reasons why we need to maintain the restrictions and why we need to navigate certain changes. We do, even though we have that understanding, we still feel it like everybody else. However, by working together, we are all in this. By working together and supporting one another, understanding that ultimately the goal is to protect those who are vulnerable. So, in working together, in relying on each other, and also on an individual basis, try to find self-care for oneself. That is why we are looking to what we see, that we have strength in our mutual work.
And before we go, I know we're limited on time right now, unfortunately, but before we go, now that it is springtime, I think all the people in assisted living have already received their COVID-19 vaccine. I was just wondering, now will we be able to see some of the assisted living people get out, do some activities outside? Now, outdoor activities will soon be allowed in the community. Are there going to be anything, I guess, more enhancements to the programs for the people at the assisted living services?
For now, we just hope that, like we are given green light, and then we will definitely pursue and try to take advantage of, doing some activities outdoors. But for now, we haven't received the green light for this.
And I guess finally, before we go, any final comments or statements or anything you'd like to say to the community, or?
Just that continue to focus on mental wellness as well. Not to lose focus. That mental wellness is also very important. Of course, we follow all the precautions to ensure that there's no spreading of the virus. However, also focus on mental health because it goes right along with the self-care.
Right. Thank you very much for joining us, Jaime. We appreciate the time you took to speak to us, and I'm sure we'll be speaking to you again in the future. Nyawagoa.
My pleasure.
Ana. And that was Jaime, who is the clinical supervisor at Assisted Living Services. Joining us next is MCK Chief Mike Delisle. Mike?
Now, Dave. Sego Kahnawake. Been a while since I've been here. I hope you, your family, friends, acquaintances, and anybody else that's not in your circle, but maybe around your bubble is safe. We're still in the midst of this global pandemic, COVID-19, which has changed everyone's lives over the last year plus. Thankfully, we haven't lost anyone in the community, but we have had some very sick people. I'm here today to talk to you a little bit about the vaccine. Understanding it's a personal choice, understanding that there are hesitations from a lot of people. Personally, I'm quite disturbed to hear that 70 pluses, our elders in the community, so to speak, are still around the 50% mark in terms of being vaccinated. That's scary to me. It's very troublesome. I would hope that, again, those are the main people that we've been trying to protect throughout through the works of the task force and everybody else that's involved, medical professionals and so on. So I would urge them to sign up. If they need assistance, it can be given. Anybody else as well who needs assistance or even has questions or commentary before they would actually sign up and or go. There have been walk-in clinics. Those things are available as well. Everybody has a valid question. Everybody has valid concerns. Address them, have them addressed. I was pleased to hear today that some measures will be eased. I won't say lifted, but given that the weather is getting better and people need to be around each other, 6 feet and masked and hand sanitizing and so on, but at least the bubble is increasing somewhat outdoors, not indoors, but more for that for people who haven't seen it yet. Again, just trying to assure that people out there understand that, in my opinion, it's very safe. I've received it a week ago Tuesday. As of next Tuesday, it'll be 14 days, so I won't be getting my next one for about 90 days, 100 days or so when the vaccination center reopens. I say reopens because my understanding as well is that it will be closing in about 2 weeks. April 6th is the defined closing date, because the expiry date of the doses that they have is then. That's the reason why, to my understanding. So we're trying to encourage as many in the community to reach that number, herd immunity, 75, 80% or so, to be safe, to continue to keep us safe. Like I said, I received mine. I'm feeling just as good and as strong and, I don't want to say vibrant, but to make people laugh as I was the morning before I got it. Yeah, my arm got sore. I had a little bit of, I'll say, not amnesia, but cloudiness for a couple of hours. Wednesday morning when I awoke, my arm was still sore, but everything else was back to normal. And today, full range of motion, no extra appendages, and I'm ready to go and waiting for my next shot. I read something recently that was very I'll say strong in terms of encouragement, where a young child was asking his mom, and many of us in this community have it from vaccines that we received as the little round circle in your upper arm. The young boy asked his mom, "What is that?" And she explained that it was vaccination for polio and other things way back when I was a child, so over 50 years ago is when I got it. But the mother said, "That's what it's for." So he asked her again, "Well, why don't I have one?" And she simply said, "Because it worked." So that's the message, I think, today. It's working. Follow the science, listen to the clinical evidence, talk to medical professionals if you need to, and get yourself vaccinated. Like I said at the beginning, it's a personal choice. We understand that. We're trying to protect not only our elders, our grandchildren, and everybody in between, to assure that our community remains healthy and safe. Along with that, as the weather gets nicer, hopefully, and I know over the winter people have tried as well, but people will be out more. So again, I think it even bodes more for the fact of getting the vaccine and ensuring that the community that you live in, that you love, remains safe. So with those few words, I encourage people to do that. Remain safe, follow the rules. I know it's difficult. Continue to wear the mask. They gave me a new one when I came in here today. It's important to continue to wash your hands. There are safety measures out there. Listen to the medicine, listen to the professionals, and assure yourself that through me and others that you'd want to speak to, I am available as others, whether they're on council or at the task force, public safety, or anybody else who's received it. Speak to them. Let them know that you have concerns, and hopefully they can be addressed. So with that, again, remain safe, be well, and we hope that we see you sometime in the near future and over the next 2 weeks at the vaccination center. Kahnawà.
Thank you very much, Mike. Much appreciated. Coming up next, our final guest of the afternoon, Commissioner of Public Safety, Lloyd Phillips. Lloyd?
Thank you very much, Mike, for those words of encouragement, and we certainly welcome anybody who wants to share their own personal story and their own personal perspective on things regarding the ongoing pandemic. And as you mentioned, certainly we all are getting tired. It's been a year plus, so certainly it's taken a toll on all of us. And that was part of the discussion that took place over the past couple of weeks and on consultation as well with our new medical advisor, Dr. Fuller, and coming up with some ways in which to address the current situation in the community, to make things a little bit easier, to relieve a little bit of the measures, and also the mental health is a major component as well. So we felt that we're able to make some changes given the situation of our community. We only have one case as we speak today. So we are comfortable in issuing a directive effective tomorrow that private home visits will be increased to a maximum of 8 people and outdoors only. At this point in time, indoors is still limited to one household with a recommendation of once per week, one other household, I should say. But now this new directive will allow for up to 8 individuals to have private home visits and gatherings, maintaining obviously the safe measures that are in place, masks, distance, hygiene, obviously, and this is for the sake of the well-being of everybody. Even if you have been vaccinated, we still have to maintain those measures for the time being. But I'm glad to be able to announce to the community that at least in this small step, we're moving gradually back to an area where there is a little more normalcy, where now you could have proper visits with friends or family who you may have not had close connection with for a long period of time. So you can continue to do that, you can start to do that. Be safe, and like I said, it's a step in the right direction for everybody's well-being. As well as we have Directive 43.1, non-contact outdoor organized sports. Again, will be permissible to reopen or restart. A lot of people have been wanting to have some level of sports and recreation, so that will be permissible as well. As we speak today, it was only up to maximum of 4 people, 4 individuals or 2 households. We feel confident to be able to move that up to maximum of 8 people. So that will be a new directive coming into place tomorrow. So organized sports will be allowed to operate a maximum of 8 people. Keeping in mind, again, same thing, masks wear required, distancing and hygiene, and doing it as safe as you possibly can. We are taking these steps and measures, again, looking at the whole well-being of all Kahnawake, and we feel that it's a proper step at this point. But we're all, again, like as always, we're watching. We want to relieve measures. We want to keep moving down this path towards normalcy. But we also have to keep in mind that there are many unknowns still out there in the community and around the community in terms of the variants that we've been hearing a lot about. There was a spike in number of cases in the province of Quebec today versus the past week or so. So we have to be mindful. We have to remain vigilant. We have to remain careful, so let's again stick together. Take these measures and implement them in your home as safely as you possibly can. And for those of you who may not feel safe having individuals in your home, by all means, your home is your castle. And if you choose not to have people visit or come over, that's certainly your prerogative, and nobody will fault you for that. So with that, maybe some final words about the vaccination campaign. As you know, that's our main focus over the past couple of weeks. We have until April 6th to get any Kahnawake who wants to be vaccinated will have the opportunity to be vaccinated. We're confident we have enough time, so please do so. And to date, I do believe we are up to about 58%. So that is very positive. We're moving gradually in that direction. As you know, we said 80% plus is our goal of the community. So we're inching that way. There are a lot of spots available. You can, as we know, KahnawakeTV.com/vaccine. You click on there, and it takes a few minutes to register to get yourself a spot for a vaccine, or you also call Category Hospital. So. Again, if you haven't done it, I certainly urge you to get vaccinated. If you have hesitations, as Mike had mentioned, there's many people out there who can answer your questions. And as well, when you sit down in the seat at the vaccination center, you'll be sitting with a nurse who could also act as your last, support, and maybe answer any final questions you may have or any hesitancy you may have. The nurse could answer your questions, hopefully put you at ease and allow you to get your vaccination. Again, we always said this from the beginning, we're all in this together, and together we will get through this. With that, Yamagoa, Kahnawake.
Yamagoa, Lloyd. And just again, before we go, just another reminder, we do only have till April the 6th to get our vaccine, so please do so, as Lloyd mentioned, and you can do so by visiting Kahnawake911.com/vaccine. You can register online there through the Click Santé, and once again, by telephone, 450-638-3930, extension 2295 or 2206. Leave a message if you don't get an answer right away. And also, we're still showcasing our testimonials for the vaccine. If you'd like to do so, you can submit your testimonial. You can send it to questions@mck.ca, or you can visit our Facebook page again, Kahnawake911. And that's it for our update today. Thank you very much for joining us. From all of us here at the Incident Command Center, Nyawagoa, Nanu, Onagiwahi.